Hi, my name is Gregory. Today I want to present the case for discussion. I don't want to have several opinions, but I'm going to show that's the way I approach this case. Patient came to my office with a broken tooth number 9. He sees the dentist previously that's with a broken with the broken number 9 with the buccal wall broken. When the dentist redo his post and core and recement his crown back again. But again, looking at the X-rays, I don't have X-rays with me right now. There was still was a space, and we can see the crown is much lower than the rest of the teeth. So by looking at this picture, you can see the rest of the teeth has secondary cavities, and that's a lingual view of this patient. You can see that the lower teeth are hitting right in the back. It's of number 9. So we can see that he's in a high occlusion on that side. This is MAP. You can see that again the teeth all over the place. And sometimes when we present the case like emergency cases, especially the front teeth, we mostly concentrate how we're going to restore that specific tooth. But how I approach this case, I also see that number 9 is a little bit wider than number 8. Number 8 a little bit slender than number 9. So, and you can see number 7, number 10 a little bit in different angles. So, and also let's see on the buccal view of this tissue, there's a little bit biological width problem with this crown. So, my next slide will show you that how this buccal wall was fractured. So I remove the crown, and you can see how deep the fracture was. But what's good part is I see the interproximal part is still intact, but buccal wall right here, this part of the area is way deep. But what positive sign, it's the gum level of number 9 is a little bit lower than number 8. So that's giving me like a leeway. If I do a little bit crown lensing procedure, I can probably manage the line of number 8, number 10, and improve the position of number 9. Again, you probably agree, not agree with my position. I know it's the best probably ways to pull the tooth out and place the implant, but again, this is another unconventional approach to this situation. You can see that I removed the post, I built the new post in the core material, and you can see on the facial view I didn't touch that wall at all, so I didn't go deeper. I just refined the margin. And the rule of thumb that is for the crown or any kind of restorations to hold on the structure, you need three numbers: 2 millimeters of the ferrule effect, 4 millimeters of the core material, and 2 millimeters of incisal reduction. I know we have a lot of posts being placed on the message board, so what kind of cement you use, which one is better. But if you keep these three numbers, you can use any kind of cement and the crown is going to hold. But of course the bonded materials, bonded crowns are going to be much. This is my CDT files. Now you can see that's preliminary picture. This is a occlusal picture. You can see I've taken occlusal pictures, or any pictures a little bit wider than just a particular tooth. The reason is I want to see the full line that's have the front teeth positioned, so make sure it's, I can probably achieve the best aesthetic result. So on the second one, you can see how I marginate this case. Sometimes in this position it's very difficult to find the right margins. Again, it's either the best, you probably do like a high definition, but you can do it. You can rotate the model and click Control B, and then it's gonna help you to marginate the margins better at this area. Just a little bit another clinical tip how you can approach this case. On the third one, you can see I define my green line around this restoration. So I'm trying to collect all the data as possible. Again, to approach this case, especially in this situation when it's number 9 not resemble the shape and the form of number 8, sometimes you do by generic reference probably is the best option here. But again, the position, again, number 8 is a little bit different shape, and you can probably work on number 8 first with a composite build-up, and then you do biological reference by generic reference. But in this case, you can have a different approach. Even you do correlation case, if I did approach in this case, you're using smooth tool, all kind of tools, to make the best aesthetic result as possible. So in this picture you can see my final restoration. You can see even here that the position of the root is a little bit more lingual compared to other teeth. And still we have to bring a little bit bulkiness here because this is the most weakest area of the front teeth. Then you can adjust in the patient's mouth. We proceed next. Put the restoration according to the black, how much translucency you want, how much the yellow part. Again, so you can play with the black size to adjust this crown. You can see the margins are a little bit rough, and I always mill front teeth end mode. My computer a little bit slow, sorry for that. And then you can select the black. You can see how the restoration was laid out in the black. Again, look at the patient's teeth, see how much translucency do you need, where do you need to put more stains, and so you have less work at the final stage. Better. So in this view you can see the final crown. What I did, I reshaped number 8, number 7 and number 10. I removed the secondary cavities, filled the spaces, and trying to match the color. But you also see in this picture I did a crown lasering procedure without raising the flap. So I used again the stoma material, stoma instrument, and went down calculating 3 millimeters away from the margins, and I removed part of the bone. You can see that's a lingual view of these restorations. It's a little bit wider, bigger than the tooth number 8. So the patient left and came back a couple weeks after. Now I see the lingual view, the restoration in 2 weeks after adjustments and putting the margins in a shape. And you can see 2 weeks after have the gums healed properly. You don't see the bluish color, margins alright, patient feels comfortable, and the color, I think it's they match almost perfectly, and the function is alright. I also managed to do a little bit equilibration on his bite, so to make sure he doesn't put a lot of tension pressure on his front teeth. If you want to see how I do equilibration, you can watch my video, equilibration with a cozy programmer. But this is the final case, and patient is happy, and I'm happy that I can probably restore those without doing any kind of aggressive procedure, and probably the patient is happy. But patient again is aware if anything happens with this tooth, we can pull it and place the implant. Okay, thank you very much.